The coronavirus, aka COVID-19, a wake up call to everyone. The best of times for some, but the worst of times for all. COVID-19 is an infectious disease that affects the respiratory system, causing trouble breathing and severe illness in many individuals. According to the Center for Disease Control, long systemic health inequities has put some members of the minority communities at higher risk of contracting the disease. Regardless of the age of the individual in the minority community, the population is still at a higher risk of experiencing severe illness. The purpose of this speech is to teach individuals the negative impact that a single virus has had on a minority community. As some of us are still quarantining in our households, the numbers of the death rates and the individuals being diagnosed with the disease continue to rise. Many of our healthcare individuals are risking their lives 10 to 12 hours a day in order to save the many individuals dying from the coronavirus. The impact that this virus has had on the minority community has been a very negative one. According to the American Action Forum, minority communities are at more risk because they are less likely to have health insurance for proper treatment. While reading over the Center for Disease Control stats, I discovered that many older individuals are dying from the virus because of the weak immune systems that they have in their bodies, and that their bodies are not being equipped enough to fight for the virus as a younger individual may be able to. Minorities are more likely to live in households that have many people living within the household, causing the virus to spread more rapidly and more quickly. Job loss has been a main factor in the minority community as well, from low income jobs where most individuals provide for their families closing, and those individuals having to find different means of income. Individuals must protect themselves at all times when moving throughout the world, making sure that they wash their hands in order to prevent the spread of the disease, and quarantine themselves for 14 days if they have been exposed to the disease. Although there are many minority communities, some communities are impacted much worse than others. For example, African Americans make up 34% of the population's COVID-19 cases. That's almost half the world's population. The main reason that African Americans are impacted the most is because they are known to have many underlying health issues prior to being exposed to the virus. Many conditions such as chronic lung disease, asthma, and or a serious heart condition, which are all leading factors that put the minority community at a higher risk. Minorities are also more likely to be uninsured, which means that they are likely to not be able to have the insurance to get the proper care that they need when it comes to their time that they need to go to the hospital for the care. And they are more likely to not be managing the chronic existing conditions that they already have. There are many ways to reduce the impact of COVID-19 virus on the minority community, starting with healthcare. Addressing the needs of the population will help the community to thrive in hard times instead of failing. Many times, most people don't know much of a virus unless it is something that the news has broadcasted, which is not always trustworthy information. There could be community interventions held in order to get more individuals to stand up for their community in order to keep it safe and prevent the spread of the disease. Many healthcare professionals could also find ways to educate and link many minority individuals to low cost health services. Also, individuals can learn more about the social determinants of health and how to improve health by changing the conditions that we live in, the conditions that we work in, and the conditions that we learn in. Many organizations within the community can provide precautions, which may include how important it is to use your face coverings. The face covering is the most prime the face covering is the most prime thing to use when trying to prevent the spread of the disease, especially especially when it comes to coughing or sneezing. The face covering, although it keeps it in, it still prevents that from other people from contracting it and breathing that dirty air in. That's not good at all. That's how they are diagnosed with the disease. Also, they could try to work with many different employers within their community to modify the policies to make sure that those employers are still being safe within the workspace. In conclusion, I hope that this speech was enough to make you save a life. But first, start with your own household. Be careful and safe. Always remember that united we stand and divided we fall. So let's all stand together to take care of one another. Thank you for listening.